The healthcare system in Indonesia continues to improve its care delivery and outcomes by an escalation in the number of health services, puskesmas and sub-puskesmas. However, more than 60% of the population is living in undeserved remote areas. The estimated report of WHO shows that 64% of all death in Indonesia is caused by non-communicable diseases, due largely to the unorganized pre-hospital care system. "60% of healthcare services in Indonesia are government-run. Currently, there are more than 10,000 health centers called puskesmas in sub-districts which are under the responsibility of the district health office, providing comprehensive health care and vaccination for the population. All public healthcare organizations have complicated challenges to manage and control the cause of various common or birth diseases. They need to have studied previous or similar situations and acquire sufficient data to better understand how to prevent and how to manage. The collection of large and significant amount of patient data is a must-job component for governmental healthcare organizations. At present, this heavy burden is manual and dependent on traditional labors, either handwritten or typed into a computer format and then printed out, which generates overwhelming amounts of paper files. This also requires extra manpower to read and analyze. Today, advanced technology development, AI systems, can collect and aggregate documents containing massive amounts of data. What is AI? AI is artificial intelligence, machine intelligence, while the natural intelligence is displayed by human beings. Artificial intelligence uses machine learning to mimic human intelligence. The computer has been installed with specially designed algorithms, which allows it to learn how to respond to specific tasks by inputting all the related information, including patient data, examination results, diagnosis, treatment, and outcomes, to create a document which is answerable, reliable, and accountable. Maternal mortality rate in Indonesia is highest in the world. It is urgent to implement an affordable and achievable solution for the government to overcome this long-standing pregnant woman's problem and prevent future issues. The RHC app is designed as a tool for the real-time management of the maternity and the infant-related Medicare. The DHO headquarters has the access to see the real-time data on the website for how many pregnant women in total at the present and how many patients are in high risk. All the pregnant women are listed by puskesmas, also shown on the map. Their medical records are shown by clicking on their names. Their home locations can be found on the map of the website. How many are expected to deliver this month? How many babies are born? How many in stage 1, stage 2, stage 3? How many are overdue date but not be recorded? The referral can be performed in real time. The responsible staff in puskesmas or district hospital can receive the referral request on the web. Patient medical record is attached. The staff can send the appointment date back to the GP immediately. The examination result will be filled and submitted to the saved medical records. GP can read the result, so this referral case is resolved. Smartphone is the best tool for patient care and monitor. All the patient medical records can be saved and sent to the server. By logging into the maternity app, you can input new patient or find high-risk patients, or key in the saved patient name in the search space. The next page shows the saved patient records. When clicking on the photo, the patient's personal information will be shown. The midwife should input all the requested information, including ANC checklist. After all the inputs are completed, the user must save before leaving the page. If you want to do checkup on the pregnant woman, click on New Session. Then, following the procedures to perform and input the data for BMI, physical examination, complaints, physical findings, required exams, and diagnosis. Select medications. All the steps are guided by protocols. However, manual inputs are also possible. For physical examination, the medical staff can choose the wireless devices or existing devices. The exam data will be automatically sent from the wireless devices or manual input. By inputting mother's delivery date, the system will create the medical records of the newborn baby. Click New Session of the pregnant woman. Input the delivery date. When you save the date, the system will ask for baby's information. In ANC checklist, you can add all the children's information in the labor history of the pregnant woman. When the baby's personal data is completed, you can create the baby's data in Pediatrics. After logging into Pediatrics, there are two ways to find the child. Either type in the child's name or the mother's name. Click on Vaccination Timetable to check the date for each required vaccination. Click New Session for a new checkup for the child. By clicking on mother's name, all the children's name will appear. This provides the information for all the brothers and sisters in the family under the same mother.